Welcome to the first episode of our U.S. healthcare series. Let's dive into the intricate ecosystem of U.S. healthcare as we spotlight its providers and payers. Let us begin by understanding the healthcare stakeholders. Stakeholders as those entities that are integrally involved in the healthcare system and would be substantially affected by reforms to the system. The major stakeholders in the healthcare system are patients, physicians, employers, insurance companies, pharmaceutical firms, and government. Insurance companies sell health coverage plans directly to patients or indirectly through employer or governmental intermediaries. Many employers offer health insurance coverage with varying deductibles and co-pays for their employees. Physicians are the providers of medical care, patients are the recipients. And government subsidizes healthcare for the elderly, the disabled and the poor. Now we dive into the healthcare providers. Healthcare providers can be categorized into medical professionals and organizations. Examples of medical professionals include physicians, nurse, therapists, pharmacists. Examples of organizations include physician offices or outpatient setting, hospitals or inpatient setting, laboratories, pharmacies, long-term care facilities, etc. Acute care is a level of health care in which a patient is treated for a brief but severe episode of illness for conditions resulting from disease or trauma. Performed in a hospital or doctor's office for quick and urgent treatment. Types of acute care include ambulatory care, hospital, specialty, and urgent care. Post-acute care services refer to a range of healthcare services provided to patients after they have been discharged from an acute care hospital. These services aim to support patients in their recovery process, facilitate a smooth transition from the hospital to a lower level of care, and improve their overall well-being. Post-acute care services can take place in various settings depending on the intensity of care the patient requires and includes nursing homes, rehabilitation centers, patient's home. Post-acute care services are beneficial as it results in lower rates of readmission to the hospital. It maximizes patient health. Prevents subsequent medical complications. Types of post-acute care services include long-term care, inpatient rehab facility, skilled nursing facility, home health care, palliative care, hospice. Now we will go over the important health insurance terminologies. Health insurance is a contract between an individual or an employer and an insurance provider that offers financial coverage for medical expenses. It is a system designed to help individuals manage the costs of healthcare services. Insurance plan. Insurance coverage is referred to as insurance plan that covers previously agreed services, and an individual gets enrolled into a plan upon paying the predetermined premium specified by the plan. Claim is a healthcare organization's itemized statement and formal request for payment from the payer for the medical services provided to the patient or the insured. Coordination of benefits or COB, for beneficiaries having multiple health plans. Coordination of benefits is a process of determining if the health insurance is a primary or secondary payer to provide medical benefits for a patient. Explanation of benefits or EOB is a statement sent by a health insurance company to covered individuals explaining what medical treatments and/or services were paid for on their behalf. Premium is the amount of money that an insured member must pay to buy an insurance policy. It can be paid monthly, quarterly, or yearly. Deductible is a specified amount that an insured member must pay before the insurance plan kicks in and starts paying for the member's treatment. Copayment or copay is a specific flat fee that an insured member must pay for a specified medical service provided, for example, a visit. Coinsurance is a fraction of the medical expenses that the insured members must pay with the remaining payment made by the insurance plan. Out-of-pocket or OOP comprises of expenses that are not reimbursed by the insurance plan. Includes deductibles, coinsurance, and copayments for covered services plus all costs for services that are not covered. Now we will go over the healthcare payers in the U.S. healthcare ecosystem. The different types of healthcare payers are: government insurance such as Medicare and Medicaid, private insurance, employee-based insurance, managed care organizations. Medicare is a national health insurance program run by the federal government that got passed in 1965. Individuals are automatically eligible for Medicare once they are past 65 years of age. Medicare covers people aged 65 and older. Some people under age 65 may qualify due to a disability or another special situation. People with end-stage renal disease. People with amyotrophic lateral sclerosis. Medicare components include Part A covering hospital services, Part B covering physician services, X-rays, lab tests, emergency services. Medicare Part C was introduced in 1997, known as Medicare Advantage. Medicare Part D or drug benefit was introduced in 2006. Medicaid was passed in 1965 and is a health insurance program to pay for healthcare services for people with low income. The Medicaid program is conditional, meaning the participants must prove they are eligible. Medicaid coverage includes children, pregnant women, elderly adults and people with disabilities, eligible low-income adults. Medicaid eligibility is determined using the modified adjusted gross income method, which considers an individual's or family's income to establish whether they qualify for Medicaid benefits. Employer-sponsored insurance is health insurance obtained through an employer and is the most common type of health coverage. It includes insurance for current employees, their families, and retired employees. In this type of insurance, the employer shares the cost of premiums with the employees. COBRA stands for Consolidated Omnibus Budget Reconciliation Act. Employer-sponsored insurance through COBRA allows individuals who lose their jobs and, therefore, lose employer coverage to remain enrolled on their employer plan for 18 months but must bear the total premium and an administrative fee. Managed health plan is a type of health insurance that contracts with providers and medical facilities to provide care for members at reduced costs. These providers make up the plan's network. Besides having healthcare providers agree to specific prices for medical care, managed care plans also attempt to reduce healthcare costs by focusing on preventive care and by using financial incentives such as charging less for generic drugs than branded ones. There are three types of managed healthcare plans. HMO. In an HMO, a PCP who will be responsible for coordinating all the members' healthcare must be selected. A referral is required before seeing a specialist or another physician. Members are required to be treated by physicians within the network. Out-of-network care is allowed in emergency cases only. In PPO, members are less likely to need a PCP and referral to see a specialist. Members can choose the physician they want to see instead of being solely restricted to the in-network providers. POS is a combination of HMO and PPO. Members must select PCP and need a referral to see a specialist. However, members can seek healthcare outside the network, often with a higher copay. Members need to stay in-network for services but may be authorized for out-of-network services in limited cases. The next video will include the basics of population health and the concept of value-based care along with a brief explanation on the payment models.